लुक छुप ना जाओ जी मन बीत कराओ जी रा क्यों तरसावे हो मन सकल दिखाओ जी थारी शरारत सब जानू मैं तो धरी
Most common dental problem we are facing here is dental caries, that means tooth decay. Followed by the second problem is gingival problem or the gum disease. The main reason of these two problems is the very poor oral hygiene. So our basic focus is to educate them how to maintain their oral hygiene, how to get treatment at early stages. So that's the basic aim is to prevent your dentition.
Hi, so I just wanted to give you guys a tour of the camp. This is the Signal and Pepsodent sponsored camp that has been run through Free the Children. And this is a partnership that has just started for the first time this year. Free the Children has been in this community now for the past year and a half. And they first started this project about 9 years ago. So this has been a long time coming, and we're really excited to be part of this dental camp. And first I'm going to show you the registration table. So this is the registration desk, and at the registration desk we ask each one of the attendees about their past medical health. We also ask whether or not they use a toothbrush or something called a neem stick, which is basically a stick from a tree that they split the branches up and use to pick out food particles from their teeth. And then we also ask what they use to brush their teeth. So they frequently use a paste. And when they're not using paste, the other common things to use are bani, which means ash. They frequently brush their teeth with ash, or tobacco product. And one of the things that we've had to combat in this camp is the belief that tobacco with menthol, that minty flavor, really cleans your teeth the same way that toothpaste does.
Okay, let's go then.
We'll take you on the way to the entertainment section. It's a little bit noisy, so we've got some drumming going on. So we'll shout a little bit.
Bye bye.
Bye. We're in the dental section now, the education section, and Emma and Vaidiki are going to explain a little bit about what we've been doing here, because they've been doing an awesome job. Like, they must be knackered, but they've been doing an awesome job too.
Okay, so if you want to come and have a look at what we're doing here. So here we're teaching the children about the basics of why they should be brushing their teeth and all the horrible diseases they might get if they don't. And then we give a demonstration as to how to do it properly, starting up and down from the front, round to the side, and then to the bottom, and then the tongue. And then we encourage a volunteer from the crowd to come and show us that they've understood what we told them and do a demonstration themselves.
दूसरे साइड करेंगे लेकिन जोर से 4 5 6 7 8 9 10 या अभी यहाँ भी करेगी वो देखो 1 2 3 4 5 6 7 8 9 10 वाह
चांदनी मन दामन में बाती को दी झुम
So this is the screening area for our dental camp, and we've got about 4 dentists in there who come in especially from Udaipur to help us with this camp. What we're doing now is that we have the community who's come in for the camp, and they're actually doing a checkup, a thorough checkup to check for cavities and gum problems.
This last area of the dental camp is the pharmacy. Here everybody's waiting in line to get their medicine. They're getting their prescriptions written.
My name is Ricky, and I work for Midway and Free the Children for past 6 years.
Hi, I'm Ankita, and I work as a senior community mobilizer for health and education in FTC from last 1.5 years.
And then, most of all, they're learning about health and sanitation, how to keep themselves clean as well as their mouth clean, how important it is to keep clean.
And in this community, a lot of people, maybe the first time they saw like how they can use the brush and how they can use it and the proper oral hygiene. A lot of people there, they never use brush, they always use fingers. So here they can learn new things and do more about.
Thank you guys.
Thank you so much.
I think we're going to get close to the 1,000 mark by the end of the week, which is, I mean, it's just phenomenal. It's like 20% of the entire population of this community, so it's, you know, a much needed health camp.
And where do you see the camp going in the future?
I think there is a very good scope of these kind of dental checkup camps in other part of villages in Jaipur, because these patients, they are not able to go to the hospitals nearby and they can't afford the dental treatment as well. So if we can provide them dental treatment at very affordable rates or free of cost, so these patients, they can have a very good benefit.
I have to say that the overwhelming feeling that I have after this entire trip is just feeling incredibly, incredibly lucky. It turns out that there were over 1,000 applicants for this trip, and I was lucky enough to be one of them, and lucky enough that the other people on the trip were some of the most incredible people that I've ever met. Lucky that the staff from Midway and genuine, good-hearted, kind, ambitious people who are just trying to help others in the world. Kids and the people were so thankful. You could just see it in their faces that they wanted to be there at the camp, and They value this experience so much, and I'm really excited for the fact that it's a partnership that is going to be going on definitely for the next year and possibly for many years to come.